So in study 1, we studied the incidence, etiology and injury characteristics of traumatic spinal cord injury in the Cape metropolitan area of South Africa. This was a population-based design in which we included all persons that sustained an injury for a 1-year period, and they were all entered into an open cohort. But what did we find? We found that the incidence was 76 per million, which is among the highest in the world when we compare it with other countries that do report this information. We found that the mean age of injury was quite young. The median age was 29 years. Thirdly, we found that males were at greater risk. Our cohort consisted 86% of male subjects. And most interestingly, the main cause of injury was quite unique to South Africa, and it was assault, which accounted for approximately 60% of all the cases. And that was followed by transport-related events, and lastly, falls. But coming back to the main cause of injury, assault, we found that most of the injuries were due to gunshot wounds and stab wounds. And this is interesting because South Africa is not a country at war. So what is the implication of our work? We need to use this information now in order to inform primary prevention strategies. But this information could also be used in order to reallocate resources for this cohort of people that sustain these injuries. But the implication is that we really need to find out what are the predisposing factors that expose individuals to violent and risky behavior, and we need to use this information to prevent future injuries from happening. Thank you.